have an increased risk of suffering a heart attack during inversions and other high air pollution days. And that's according to a unique study done by researchers at Intermountain Medical Center, Heart Institute, and Brigham Young University. So when you were in California, did you feel shortness of breath at all?
Yes.
When 54-year-old Maria Lim moved to Utah a few years ago, she expected those conditions to disappear. They're not as bad, but Maria has to watch out for Utah's inversions and high air pollution days.
Living here in Utah, it's a risk.
And even more so because Maria's blood type is B positive, which according to a new study puts her in a category for a higher risk of a heart attack. Dr. Benjamin Horne, the lead investigator in the study and a clinical epidemiologist at Intermountain Medical Center Heart Institute, tested the gene that determines blood type and found patients with coronary artery disease with non-O blood types had a higher risk of a heart attack. The link between pollution, certain blood types, and heart attacks is important for Utahns to know, and it affects about half of the population.
We found that for individuals with A, B, or AB blood type, that there was a higher risk of heart attack or unstable chest pain during a high air pollution PM 2.5 event.
Maria is aware of her risk and stays indoors on bad air days. Family history is also a risk factor for Maria.
My father died at 53, and I had my oldest brother that died at 48, and another brother at 33. The three of them died of a heart attack. I want to make sure I'm knowledgeable about it so I can take care of myself.
Dr. Horne says it's important to reduce your risk. Stay indoors, which includes exercising indoors on high air pollution days, and take the necessary heart medication.
I'm really grateful for the studies that they've done, because this way people can get information.
Dr. Horne says this new information and this new link is not something to panic over, but something to definitely be aware of and put yourself in check and make sure that you are following all the doctor's orders.
Yeah, and that's really important given the troubles we have with air quality around here.
Definitely something our patient is keen on and she deals with every day.
All right, coming up after the break, the lights.